care of inpatients with highly complex conditions is orchestrated by digital communications. Patients in outpatient settings across the world can access top specialists as if they were next door. Health status is monitored so caregivers often know about problems before patients do. Smartphones are harnessed as tools for making care more convenient and higher in quality. Institutions such as Cleveland Clinic are the beacons that demonstrate to the nation and to the entire world why the digital revolution is important and how it can bring about the goals we all have for healthcare: greater longevity, less discomfort, better value, and fewer hassles. This book distills the lessons learned at Cleveland Clinic over the past 25 years into a single and useful reference. C. Martin Harris, M.D., whom I met in residency and fellowship 30 years ago, was among the first physician information technology leaders. While I followed the entrepreneurial route, Dr. Harris joined Cleveland Clinic as its Chief Information Officer and pioneered what has now become a required senior executive position in every healthcare system. In his role, Dr. Harris has been at the forefront of the major leaps in health information, quality measurement, teleradiology, consumer engagement, provider communications, workflow management, point-of-care electronic records, telemedicine, and many others. He has been a steadfast and relentless agent of change and has all but written the book, which now he has, on how information drives clinical, technical, and financial success. Martin Harris has few peers with his depth of experience, perseverance, respect, and results. We are in the early days of digital medicine. As the current wave of electronic record adoption ebbs, the next frontiers of health information are coming into view. Large-scale data analysis, remote care delivery, real-time physiologic monitoring, personalized treatments, and robotics are some of the ways that the last decade of investment will have a meaningful and durable impact on human life. We should continue to watch and learn from Martin Harris and Cleveland Clinic as they lead the way to this promising future of healthcare. David Brailer, M.D., Ph.D., CEO, Health Evolution Partners, National Health Information Technology Coordinator, U.S. Health and Human Services Department, 2004 to 2007. Introduction. If you are ever in a situation where you cannot speak for yourself, your electronic medical record will speak for you. That's what I said on Thursday, January 27, 2005, from my place on a stage that had been so recently built that it still smelled of sawdust and glue. It was just one sentence in my 15 or so minutes of prepared remarks, and while I couldn't possibly have known it at the time, I have since come to realize that it is probably the single most prescient sentence I have ever uttered. It is the one that has had the greatest impact on the integrated health information technology work we have done at Cleveland Clinic during the past 15 years, and it will, I am sure, continue to inform the work we will do for years to come. Here's why. Along with several others, I shared the stage with the President of the United States, George W. Bush, who was visiting Cleveland Clinic to promote a national initiative he had formally introduced during an address he delivered on April 26, 2004, when he announced that, within 10 years, every American must have a personal electronic medical record. We were in the grand ballroom of the brand-new Intercontinental Hotel on Cleveland Clinic's main campus. Somewhere out in the darkness beyond the Klieg lights was an overflow crowd of Cleveland Clinic employees, philanthropic supporters, political dignitaries, local residents, and, crucially, since he would in short order become instrumental in the next phase of the advanced technology work that thousands of Cleveland Clinic caregivers were doing.